President and CEO of Salmon Regional Medical Center, and Dr. Erin Philpott, another just friend of the show.
That's right.
So
long-standing.
Yes. So we're glad they're joining us from the hospital via WebEx. And so they are there. There they are. Good morning, both of you. Thank you for joining us.
Good morning. Thanks for having us.
Good morning.
You bet. Great to see you both. And so let's get started. And Jeff Bourgeois, can you give us kind of an update on conditions at Salmon Regional Medical Center? We're seeing and hearing about an increase in COVID cases nationwide and statewide. Does that hold true here as well?
Absolutely. And unfortunately so. In just a few short weeks, we have seen our inpatient COVID census go from around 3 up to around 39 so far this week. Overall, we have right at 149 plus patients holding or in inpatient beds right now. And again, 39 or so of those are COVID. Total of 12 intubated patients and 6 of those are COVID intubated patients. What we are seeing in our emergency department and our urgent care is a sharp increase in the number of individuals presenting with flu-like symptoms and seeking care and attention for their needs. And what we are seeing is at least identical to what's going on in almost every single community and hospital within our state. ICUs are full everywhere. The state earlier this month stood up its statewide central transfer center for adult critical care patients. And we, as a regional hub, one of 7 in the state, participate in that call center. And the critical care transfer request coming into that call center from hospitals across the state, as well as neighboring states, it's a very high volume, and it truly is a concerning time for all of us, and so we hated to see this very sharp and quick increase in our inpatient COVID experience. So that's what we have currently at the hospital.
Yes, so obviously very serious and critical. And Dr. Philpott, maybe you can answer this question about the Delta variant. We had a sundry of other variants that were happening a few months ago. This one hit the scene, seems to be much more virulent. I mean, what is the difference between this Delta variant and what we were dealing with before?
Yeah, great question, Megan. We've seen a number of different variants, as you've mentioned, that have emerged in different parts of the world. The Delta variant, because of its transmissibility, so as you recall, we've talked about this before with these viruses, they mutate over time. So the more opportunity for infection, so more people infected, the more opportunity for mutation. And they mutate typically with what's called a gain-of-function mutation, which means they're more fit to survive and thrive. So they're often more transmissible or more severe, more fatal. And that's what we've seen with the Delta variant. The original variant, the wild-type variant that we first saw here in our spring surge, the Alpha variant, was if you recall, we talked about the R naught early on. So that's the number of people infected for every one person who has COVID. So that looked to be early on around 2. So one person, if I had COVID, I could potentially infect 2 other people with the Alpha variant. And that has significantly increased with the Delta variant. It over doubled, in fact. So it's much more transmissible, which is why it's emerged to be accounting for a majority of cases now in the United States, including here in our community and San Juan County in general. So that has significant impact. It can just find people, it's especially unvaccinated people, a lot more easily. I'd say very commonly patients coming in now Of course, I asked about vaccine status as I think that is very pertinent to prognosis here in the hospital. But also, if people recall, if they had a COVID contact, and I would say early on, people knew they would have a very specific contact or prolonged contact with the person. And I'd say a majority of patients no longer know where they picked COVID up, which I think is a pretty good reflection of that increased transmissibility.
Right. And so I guess, Jeff Bourgeois, back to you with this question, and maybe Dr. Philpott chime in as well. But I guess from what Dr. Philpott was saying, we are seeing, obviously, patients with Delta variant testing positive at the hospital. And Jeff Bourgeois, are you tracking that? And are you tracking how many of your patients are coming in that are maybe unvaccinated? Is that something that you would be able to track as well?
Certainly, on the vaccine status specifically, Scott, we are able to track that. And as far as our hospitalized patients, these are, I guess, the directionally accurate numbers because I don't have the most recent on top of mind. Dr. Philpott, if you know something more accurate, let me know. But of our hospitalized patients, roughly 85 to 90% are unvaccinated. The balance are vaccinated. So there are truly breakthrough cases, but that is to be expected. When you think of the most effective vaccine as of these COVID-19 vaccines as being roughly 95% effective, that means if 100,000 people get vaccinated, there's still statistically 5,000 that will get an infection. And so it's not unexpected to see vaccinated patients get hospitalized. What we do know is that the vaccine is our single best weapon in combating the spread of this disease. It can help prevent an infected person's level of transmissibility to another person. If they do get COVID as a vaccinated person, the vaccine will help reduce the severity of their illness and also reduce their risk of mortality. So as a community, we still have a long way to go in terms of achieving a level of vaccination that will really help our community get a better handle on the spread of this disease. So I would urge every single individual who hears this message, who has not yet sought out a vaccine, to strongly encourage to do so. There has been an unfortunate wealth of inaccurate and misleading information out in various forms of social media, etc., about the vaccine. I choose to put my trust in the CDC and the analysis by the scientific community that says these vaccines are safe and effective and are the single best tool we have of getting out of this now 18-month-long nightmare.
Right. I'm sorry, Jeff, go ahead.
Well, if people want to help the caregivers in this hospital, throughout this community, and throughout our state and elsewhere, put an end to this, please strongly consider the vaccine and understand it's our best tool. And if you have questions, go to your healthcare professional, to your physician, a trusted clinician, and seek their guidance on the benefits and risk associated with the vaccine. Do not believe everything you see on social media, because there is just a world of inaccurate and just blatantly false and misleading information.
Absolutely. And Dr. Philpott, I mean, it's been a while since we nerded out on how this vaccine works. And so maybe we can get a little review, like a bite-sized review on how this vaccine works, because I think that's part of the misleading information out there.
Sure. Yeah. And I just want to, I think Jeff really stated that very well. I just wanted to add a couple of things kind of along the same lines. The individual benefit of the vaccination in preventing hospitalization in the face of the Delta virus is still very high. like upper 90s. So even though we're seeing a portion of, or a small portion of our hospitalized patients having been vaccinated, the personal risk is low after the vaccine. I think another notable thing to mention here is with the Delta virus, it appears to be likely much higher viral loads in the nares, which is probably contributing to its transmissibility. So even among these breakthrough cases, one study showed about 1,000-fold increased viral load compared to the Alpha variant. So even in these breakthrough cases, people, in contrast to sort of the previous data on other variants, people are still able to transmit. And that's why the masking has been brought back as this extra layer of prevention and support, even among vaccinated individuals. So as far as the vaccines go in reducing or preventing infection with COVID, and certainly very effective at preventing severe COVID, including hospitalization and death, the mRNA vaccines, as we recall, are a little tiny piece of the RNA that the body can take into the cell, not into the nucleus where it impacts our human DNA, but is then replicated and then presented to the body. And then our bodies respond by making antibodies. And then we have memory T cells, which make other types of immune cells, and then B cells, which make antibodies. And then these antibodies are, actively circulating, and we often feel a little crummy after the vaccine, especially the second one in the Moderna and Pfizer shot. And then we have memory. So when we're exposed to COVID later on, if we're exposed to COVID, our immune system remembers this spike protein, which is the little piece of mRNA in the vaccines, and it can respond and protect us from the severe infection and all the ensuing complications that come with COVID. And then the Johnson & Johnson, the one-shot deal, is a little bit different as it uses an adenovirus vector, which is an attenuated or type of virus, a benign virus that presents that to the body and works similarly in generating an immune response.
Thank you for that, Dr. Philpott. I think it's a good reminder to all of us of just how effective this vaccine is. And we saw that, and we continue to see that in some of the, numbers of vaccinated folks who are being hospitalized, and they're just not there as high as the unvaccinated folks, as you mentioned earlier, Jeff Bourgeois. And let me ask you to go back a little bit to what you said early on about the restart, if you will, or the usage again in New Mexico about that patient referral program and having to move patients around to hospitals who maybe have access or open beds and other hospitals that don't. I mean, this is where we were. I think we had this conversation in the spring, didn't we, Jeff Bourgeois, at some of the peak of the surges that we were experiencing? You're telling me that we're back in that area again?
Absolutely.
Sigh.
Yeah. Jeez.
Yeah. And this is, go ahead.
I was just going to add, Scott, I think each surge has has had a distinctive challenge. Obviously, this surge is, we're a year and a half in, and we've lost a lot. We've lost a lot of healthcare workers nationwide, statewide, everywhere, as far as workers and even related to COVID and deaths for some. But I think with this surge, with the original spring surge, we were a highly impacted region in our state, the Northwest region, us in San Juan County as well as Gallup. And this is really more of a pervasive, widespread situation happening, which really with a superimposed large volume of high acuity patients. So ICU level of care patients from delayed care, from lack of care of their chronic medical conditions over the last year, substance abuse, depression, suicides related to all these people who've lost family members. So we are just sort of in this synergistic spot that is very distinctive from the spring surge with significant challenges.
Right. And so, Dr. Philpott, can you maybe take us through a little bit about we're seeing, the FDA has approved the Pfizer vaccine. That just happened this week. So maybe more folks who were a little hesitant will now be rolling up their sleeves and getting the vaccine. We certainly hope so. I think vaccination numbers are going up across the country, which is encouraging. But can you just take us through? I mean, if we had magically 90% of the population suddenly vaccinated against COVID, wouldn't that help slow down these variants and the mutations and things along that line to get us out of this? Is that how you and others see us getting out of this situation?
Yes, absolutely, Scott. I think the way I started thinking of this morning again, which I hate to even bring up again, but that concept of flattening the curve that we talked about so often last spring, and that was, these different mitigation measures like staying home and wearing masks. I feel like the vaccine is truly, at this point, a mitigation measure to prevent sort of collapse, not to be dramatic here, but straining the medical system in the United States. I think the South is seeing really difficult times in this with this surge compared to previously. So I think the vaccine, while at this point with the variant that has evolved, will be difficult to eliminate it. We had calculating herd immunity changes. Herd immunity increases as the R naught goes up, so it would be even higher with the Delta variant. But when we think about hospitalizations, and then of course deaths, but hospitalizations or impact on the system, vaccines are absolutely the answer. I mean, vaccines are the answer on a personal level, protecting your community level, protecting your family, reducing the impact of COVID on society. I mean, this I do truly feel is the way out. I think Israel is a good example of a world sort of, or a country that is highly vaccinated, and they are seeing cases and some hospitalizations. And I think that's just this Delta variant is highly efficient and effective in finding a host, in finding a person that's not been vaccinated or is susceptible to it. But most certainly vaccines are what we need to move forward.
And so on that point, let's talk about boosters here. First of all, correct me if I'm wrong, but it's the same shot, really, so it's not some special formula. And this is something that they've recommended 8 months after somebody's last dose. Is that a hard science, or is this our best guess based on people getting sick again? What's the deal with the boosters?
Yeah, that's a great question, Megan. There's a lot of, unfortunately, it's been such a confusing time, I think, for the general population as the scientific community kind of debates things. There's some debate about the booster, I will say, among sort of the leading scientists, if you will. It sounds like they plan to offer it, as you said. However, I think it's starting September 30th. However, the debate is this: what are we going for here? Are we trying to reduce hospitalization and death? Because even with waning or potentially waning immunity, like for me and Jeff as well, we got our vaccines in December, January. So we're a few months out now. So is our immunity waning? Probably a little bit. You get often better immunity when you space the shots out more, which the UK ended up doing. So it'll be interesting to see kind of how the impact is there. So is the goal to prevent hospitalization and death? Then we probably still are good. Is the goal to prevent infection and breakthrough cases? Then the boosters probably indicate it. And then, of course, it's already been offered to people with immune-compromising conditions. So they did say there should be plenty of vaccines for both first and second dose people in addition to the booster when it becomes available. But still some debate there, I believe.
Understood. And so before we let you both go this morning, again, I just kind of wanted you to maybe repeat, if you would, your request, your plea to the community, to the public to help kind of avoid another big crazy surge like we saw earlier this year. If it's not too late, I know you're still seeing increasing number of patients and hospitalizations. But beyond that, I think too, as we've talked about, getting this vaccine, getting this virus under control to protect not just our loved ones and the things that we love to do, restaurants, schools, face-to-face classes, sporting events, all these things that we are trying to get back to enjoy are at risk, right? If this gets out of control. And so maybe just a reminder again before we go of what you all are seeing at the hospital each and every day, unfortunately, at this time. Jeff Bourgeois?
Thank you, Scott and Megan, for your time today. I would have several asks on the part of your listeners. First and foremost, if you're not vaccinated, our plea is that you strongly consider doing so. Seek the advice of your physician in going through the benefits and risks. The science is clear. The benefits far outweigh the risks, despite what false information might be circulating in social media and elsewhere. Secondly, continue COVID-safe practices to help minimize the risk, whether you're vaccinated or not. Social distancing, mask wearing, hand washing, etc. This is an invisible enemy, and we let our guard down and it slips in. And as you heard Dr. Philpott describe, the transmissibility of this Delta variant is so much higher than earlier variants that if an individual member of a household contracts the virus, the likelihood of other members of your family or those you share the house with increases significantly. And then my final ask of your listeners, Scott and Megan, would be to continue to lift up the caregivers who are on the front line of this fight. And think of them when you think of whether or not to get vaccinated. Think of what they've been through for 18 months. The unbelievable physical, emotional, and just stress they've been through. The stress of caring for COVID patients in these circumstances has literally driven healthcare professionals out of their profession. They just decided they couldn't take it anymore for their own personal well-being. If we're going to prevent further deterioration of our healthcare system, we've got to do everything we can to get this pandemic under control. And I would encourage you, also, please ask your listeners, to thank a caregiver. If you see one out in public, or if you know one, send them a note. We have set up an email address simply titled Thank a Caregiver at sjrmc.net. That's Thank a Caregiver, all one word, at sjrmc.net. And if you just want to thank one in particular or thank just a general note of thanks and appreciation, we will be sure and share those broadly throughout the organization. So Megan and Scott, thank you.
Thank you. Dr. Philpott, do you have anything to add?
Yeah, I think all the same sentiments and thoughts. The vaccine is, I know, a challenging issue for some. And I just want to say 55 billion people globally have been vaccinated. This is the most highly scrutinized, researched, and given vaccine of all of history. And I think looking at it that way should be really reassuring. There have been just 2 very rare safety events, including myocarditis, as well as these rare blood clots in the brain that have really risen out of the vaccine. So I think, as Jeff said, the risk-benefit ratio is far in favor of the benefit at this point. I know it's super difficult to feel instructed to get this through mandates, but I think there's just so many ways to look at it as far as benefit, and definitely encourage discussion with providers and trusted sources to get the information you need to feel comfortable. getting it to protect, you, your family, your community, and to help all of us as well.
Well, great. Dr. Erin Philpott and Jeff Bourgeois, thank you so much for joining us. And it really sounds trite to say, but hang in there, and we're supporting you. And so we look forward to hearing better updates next time we talk to you.
All right. Thank you.